Hello, my name is Michael Lichtenberg from Arnsberg Vascular Centre. I'm an interventional angiologist working in the peripheral and the central vascular field. So intravascular ultrasound has gained more and more interest and shown very positive data for patients with peripheral artery disease. We recently saw prospective and retrospective randomized trials which proved efficacy of IVUS-guided peripheral intervention, much better outcomes with IVUS guidance than with angio-only guidance. The disadvantage of an IVUS-guided intervention is that, at least in my country, as well as in other European countries, IVUS is not reimbursed, meaning we are not getting any money for this IVUS catheter, and that is when we are doing peripheral interventions. So we aim to analyze if, beside of very good clinical outcome data, IVUS is also cost effective. And this is what this cost utility analysis of IVUS-guided percutaneous transluminal angioplasty in patients with peripheral artery disease aim to do. And this is what I would like to report on now. So the design was quite simple. As in all economic analysis for medical devices, we created a Markov model for this, a kind of decision tree to model one event, a 1 year post-index PTA analysis event, then followed by a lifetime Markov model analysis to see if the economic data for IVUS might be positive to convince payers to reimburse intravascular ultrasound for peripheral artery disease. So we created an incremental cost effectiveness ratio analysis as the primary outcome of this economic evaluation. These incremental cost effectiveness ratio is quite simple. So what they're doing is you take the cost of IVUS-guided PTA minus the cost of angiography-guided PTA divided by quality of life of an IVUS-guided PTA means quality of life angiography-guided PTA. And if this analysis, if this ratio is below a certain threshold, you can name this positive in an economic analysis way. So for Germany, we typically define 50,000 euros per quality of life gained as economic, from an economic standpoint, positive. So if this ratio is less than this threshold, you can say IVUS is cost effective. If the ratio is higher than this 50,000 euro, IVUS is not cost effective. So we definitely could show, based on the literature, on the retrospective data, and especially the randomized trials and some other trials, that an IVUS-guided PTA was shown to be cost effective over angiography-guided PTA in the 1 year horizon and dominant, this is a little bit difference, in the lifetime horizon. So there's a clear hint that IVUS-guided peripheral intervention is cost-effective, especially in terms of re-intervention and amputation-free survival, including rehospitalization. And this could, from our perspective, convince payers to invest and to reimburse IVUS-guided PTA, as we are creating much better clinical outcome, which then show a better economic situation than with standard angiography-guided PTA. So I think it's another hint that IVUS is makes definitely sense, beside of the very positive data we have from retrospective and prospective trials, that we can also say the IVUS, based on these positive data, helps us in the treatment of our patients, and we are not harming the situation, the economic situation, and overall using too much IVUS. So I think the next step would be to really create more evidence here. This is the first hint that IVUS is economic positive, from an economic standpoint positive, but I think with a new data, which we are seeing at the moment. We recently saw in a prospective randomized trial, which showed very positive data in favor for the IVUS. If we include this in such an economic analysis using a Markov model, I think we can convince a lot of peripheral interventional specialists that IVUS definitely makes sense, not only from the clinical side, but also from an economic side.